So I think we can call the meeting to order. Let's see, what time is it? We're 1 minute ahead, so 1 minute saved is 1 minute gained. I'm looking for a motion to move the minutes of the last meeting, which was December 9th. Chuck, are you on board with that?
I'm okay with that. Thank you.
We have a motion.
Dr. Strauss, can I just do a point of order here so that you can announce that you guys are here, present, by stating your name? And we'll do our same messaging with regards to this meeting is held electronically via Zoom based on the governor's stay-at-home order, which we're still under. We do have access to this, and this meeting is being recorded. People can join this meeting by clicking on the meeting ID 863-9978-9686. Passcode is 271193. And they can join by telephone 1-646-876-9923. And if people have any problems joining by audio, they can call 603-821-2049. Dr. Storrs.
Hi, Tony Storrs, Chairman of the Board. I am at home with Luca, who appreciates that beautiful picture that Nicole took of her him yesterday. And I can hear everybody. And Chuck, up to you.
Oh, good afternoon, everybody. I'm Chuck Capetta, Board of Health member. I'm at home and can hear everybody, and no one else is here.
Cool. Why don't we go right around?
I think Tony, I'm sorry, Stephanie did send a communication that she might be late if she's going to make this meeting.
Okay. We'll go as far as we can, for sure. Do we want to go around the table and say who we are?
You don't have to do that if it's going to take up too much time. It's just the board members that really have to announce that they're here. And as we do our reports, if you want it, we can introduce ourselves at that time.
Sounds cool. I like it. It's more efficient. Okay, we have a motion on the floor to accept the minutes. I'll second that. Any discussion, housekeeping, anything like that?
Okay, from my end. Thank you.
Okay, same here. I have a vote to pass.
Yes.
Unanimous. Moving on to item number 2. One of the things I did want to say, I just got an email today. I went on the VAMS system yesterday for the second shot, and everything was frozen in February. And I just got an email from the New Hampshire Dental Society that they were reached out from DHHS, and half of the February appointments are now available, and the other half will be available by the end of the day. I guess they had a glitch in the system. So anyway, if anybody comes to you and says I couldn't get on, that's the reason. All right, moving on. Director's update.
All right, thank you, Dr. Storrs. Bobby Bagley, Division Director for Division of Public Health and Community Services. I am in my office, our temporary space at 142 Main Street, and just wanted to give I did the report based on a sort of like a quarterly overview, because most of our meetings from I want to say September on, we were heavily focused with addressing particular items. If it wasn't the updating to the mask mandate, to other discussions with regards to very pertinent COVID related things, including the curfew.
He's in the middle of a game.
Sorry. So I wanted to, so the way that this was put together was based on those past couple of months that we haven't had a chance to go through our regular report outs. And so in the director's report, as you can see, we continue to provide COVID related activities with all of our staff repurposed to address the mitigation efforts that have been ongoing, which includes our testing clinics, disease investigation, surveillance, contact tracing, and education. And each of our staff that will be reporting out will talk about some of the activities that they have been busy with over the past month. During this quarter, initiatives that I was involved with specifically, we did get a couple of funding sources allocated to our division to continue with enhanced COVID-related activities. And so we did receive funds from the state in the amount of $896,349 to bring on some community health workers to specifically support our cultural and linguistic services as we address population groups that may not always have a focus on and have not been in a position to access either testing, and as we move into the vaccine phase, the vaccine. So we're going to have the opportunity to be very intentional with our outreach to those populations, as well as be able to provide information in languages beyond Spanish. We've been very good with our ability to do that. And so the community health workers that we've hired on actually bring to us 6, 7, 8 different languages that we did not have here at the health department, including Spanish. So we're very excited about that. We have a great communications team and marketing team that have been doing a fantastic job with our messaging, and now we'll be able to enhance that. Funds from this particular grant will also support the hiring of additional staff. So we were able to bring on a couple of other folks. And we also had our CDC surge capacity staff that have been with us throughout this time. We also received funding in the amount of the total $35,000 to support adult flu vaccinations and COVID vaccination efforts. So $10,000 for adult flu and $25,000 for COVID vaccine. So that's important for us, again, to be able to do this well, you know, in our community. Over the quarter, because we're in our 10th month, going into our 11th month now of COVID response, and I smile because it has been a tremendous amount of work. The division staff has been phenomenal in our response, but you can imagine that it has also been a draw and a drain on physical, you know, and emotional health because of the response, you know, that we've had to move in, the amount of hours that have been worked. And so there was, you know, times when I had to really focus on our mental and emotional support for our staff, and, you know, worked with other staff to try and put together some things to show appreciation and recognition and accomplishments during this past quarter. And I hope that, you know, staff receive those things in the best, you know, heart and intention, because of just the appreciation and gratitude we have for what they've been doing in the community in Nashua and the greater Nashua area. Also participated, so there was other work that was still focused on. So I still am on the Public Health Services Improvement Council as an advisor, participated in the State Health Improvement Council and subcommittee group, worked with the Governor's Equity Task Force. They had grant dollars that they sent out, so I was on their award review committee. We also participated on the Board of Education meetings throughout their time with providing them with situational updates, and participate in the mayor's town hall meetings that he has to, again, keep the city of Nashua, you know, up to speed on things that are happening with the city with COVID updates as well. I am very happy to also report out that our total staffing at the division is up to 37 now. For decades, public health has been underfunded and we've been understaffed, but we've been making it through. But COVID has shown us that we can't continue to try to do more with less. Through the CDC surge capacity, we were able to get 8 additional staff on board with us. And each of our departments is also fully staffed. We have some new hires. Mike Apollo was a CDC surge staff person, and we were able to bring him on full-time as our emergency preparedness coordinator during this quarter. Jennifer Sabowitz was also a CDC surge staff, and we were able to hire her on as our public health nurse coordinator in our immunization program. And Jane Goodman was also a part of the CDC surge staff. She's been hired as our public health strategist. And then we have 3 community health workers, Abimana and Giera, Sylvia Patuk, and Nellie. She told me how to say her name, and I'm not going to say it because I don't want to butcher it, but it sounds very French. They've all been brought on board in response to the money that we've received from the New Hampshire Travel Foundation, as well as Department of Health and Human Services. Timothy Poitras was brought on with the environmental health, and he has hit the ground running and he's doing very well. And Eraida Munez, it will be starting with us next week as a welfare case technician. So we're very excited to have all the staff on board. And then these are the CDC SURge staff that continue to work with us. And the CDC has let us know that we're able to continue to have Jamie and Marley, as well as Anne, until June. And that's awesome. Colin is also on board with us. Colin has done good work with us, and he'll be leaving us on Friday because he was able to find another position, and we're excited about that for him. And Sarah Saeed was also on board with us as CDC SURge staff and working with our communication specialist. And then these are just some other things that I have here that are in the report. If you have any questions on these things, we continue to make sure that we stay updated in things. We continue to provide opportunities for medical students at UNE. They were the ones that were able to send their students with us throughout the months of COVID during the fall. And we're expecting that some nursing students will be able to join us in this upcoming semester, as well as at least one, I'm not sure, and at least one public health or a few public health students as well. Other highlights, Angela Constantino and Nicole presented at APHA, and that may have been reported out in November, I think, maybe. We've been involved with numerous committee meetings and involved with state planning around COVID activities. And so we've just, as you guys know, have been inundated with COVID activities, and the staff have done really well in their response. We've had multiple opportunities for press conference, and we've had a great deal of media coverage as well, which I think is really important for the community to be kept informed. And that's my report.
Oh.
Did we lose Tony?
Oh.
Dr. Sturz, did we lose the chair?
Must have.
No, the chair got muted by himself and then forgot to unmute. Can you hear me now?
Yes.
Okay, so I'll just say it again. Thank you, Bobby. Are there any questions or comments for Bobby?
Well, Bobby, I just too wanted to echo Tony's comments and just your words yourself. Phenomenal effort again, as always. And it was great to, I'm now getting the weekly updates, which I don't think I appreciated how much effort goes into producing that. And it was fun to read about Sylvia and Mana, the little bios on each of them. That would be great if you could do that every month, you know, just to put a name to the face. And that was wonderful. And my other question was providing mental and emotional support to staff. Do we have, as a Board of Health, do we have any rainy day funds or little piggy bank funds that, you know, I know finances aren't always the issue, but how to show them our true appreciation of what they mean to all of us as a group, as we all work and collaborate together. I just think especially during these difficult times, it'd be fun to have a little token. I don't know if there's a little get together. It's hard to say that because now we can't meet, but I just would love to put that in the future when we get away from this, that we can somehow get together and have a celebration of all this hard work, you know. So I think you're all wonderful. Thank you.
Thank you.
Chuck, I think we can arrange something. It'd be great if when we're back together to laugh and put this behind us, but if that's not going to happen in the foreseeable future, listening to Alex last night, he's talking 2023. I think we can come up with something somehow to celebrate and to recognize people. So Bobby, you and I can talk, I and Chuck can talk about that afterwards.
Okay. And
Sound
we've got great people here that had some great ideas as well. We did some pretty neat things over the quarter that I thought were fun and that I really hope that the staff appreciated. So we'll get together and I'll share what those things were.
I'll leave it to you to remember that because short-term memory is going quickly. Saying that, I'd like to move on, if it's okay, to Michael on emergency preparedness.
Michael, can you see your report? Unfortunately, we can't hear you.
You think he's on mute?
No, I think he's gonna call in Dr. Sturris because his audio may not be working on his computer. And it looks like Stephanie has joined us.
Okay.
Yes.
Hi.
My apologies for
Those-
being late.
No, I'm going to be leaving early, so I'm glad you showed up. If Michael's not ready yet, you think Angela? Oh, Mike, are you on?
Yes, I'm on. Can you hear me now?
Yeah, great. Go ahead. You've got the wheel.
Okay, I have the video from my laptop and the audio from my phone, so please excuse any delays that may occur. As Bobby mentioned, I joined the division back on October 5th, and I've really been at it every single day. I was doing a lot of work with the division in my previous role with the CDC Foundation, and I'm glad to have joined the staff here. I think we do tremendous work every week. Here is my report for the month of December. I'd like to first start off by saying that our COVID-19 testing clinics continue each week. We actually changed the location from the Elm Street parking garage over to the National Guard Armory on Daniel Webster Highway. And this has been tremendous for both our staff and our test clients. There's much more room for cars to queue up. We keep them off the public roadways. We have restroom access for staff. In addition, we received delivery of the inflatable shelter that was purchased this past summer. That has also been set up at each of our weekly COVID-19 testing sites. Bobby did mention the press coverage that the division has received over the last few months. I participated in an interview a few weeks ago regarding the vaccine deployment. I also received my COVID vaccine back in December. We continue to meet weekly with our public health, healthcare emergency response coalition, and that's our focus in that meeting is centered around medical surge capacity. So meeting with our major medical partners to see what kind of issues they're dealing with on a week-to-week basis and how we can best support. And the last thing I'll mention here, another highlight, we did a community flu clinic in Brookline back in December. We delivered 70 doses of influenza vaccine to members of that community. There were some social media posts about that. We were able to vaccinate Santa Claus, which was a highlight. Please check out our social media accounts. You can see that photo there. And I'd be happy to take any questions that anyone might have.
This is Stephanie. The CDC has published new guidelines for distribution for 65s and over, which is not consistent with the 1B, which is, I believe, what we're teed up for right now. How will we achieve coordination with these new recommendations, which the public will be aware of, but which we are not primed to do based on our last few months of planning?
Thank you, Steph, for that great question. This is something that we've been dealing with since the governor did announce the later phases of the vaccine distribution. I believe it was last Tuesday. There was also a lot of disappointment that it was no longer focused on folks supporting critical infrastructure. So there's no longer a carve out folks doing essential services. This is something that we're going to continue to work with our state partners on and our regional partners, and just do our best to push out public information for those that may be concerned, hearing from family members or relatives in other states that are eligible for vaccine, who may not be able to receive the vaccine here in New Hampshire. Bobby, do you have any other comments on that?
Well, just that, I mean, it's interesting that the federal government is moving so fast and they're changing through the phases of vaccine allocation and expectation, with the states when they're trying to keep up with that. In New Hampshire, the plan is to roll out 1B the last week in January. I don't know how swiftly they're going to move through to get to 2A, because age 65 and others are in that 2A category. at this point, in speaking with the state last night, they do not have any intentions as of right now to switch over and include the 65 and under 65 age group into this phase that we're going to be moving in at the end of the month, because we need to get through that group first. But things are fluid, you know, and things change. But at this point right now, the plan is to stay within the phase rollout that we have. So it'll be 1B, which is over 75, and those with underlying health conditions. Now, with that said, though, those individuals with underlying health conditions can be of any age, right? And so that could be someone that's 30 or 40 years old that has two comorbidities that put them in a highest risk for either adverse health conditions if they were to contract COVID, hospitalization, or death. And so I think if folks have to kind of look at the rollout that way, that we want to make sure that we vaccinate the most vulnerable as quickly as we can. And those that are 65, if they have comorbidities, they will be included in that rollout with 1B. And so that's a part of the messaging and communication that we have to help our public understand, you know, how this rollout will work.
Yeah, I mean, those are great answers. I think that's realistic. I have two concerns that I'll share that can be incorporated over the next several weeks in communication and in planning. What is that if you look at the CDC guidelines for what constitutes a comorbidity, there's, you know, a dozen or so conditions that are absolute. And then there's a secondary list of mays or mites, and things like high blood pressure are on there. And that really wasn't in the original list of comorbidities that would make you more likely to have what you just described, Bobby. So I think that that is going to be confusing to people. The second thing is that there's very interesting statistics coming out of Israel right now, which is due to the fact that they have had such a rapid rate of immunization, and about 17% of the people that are being hospitalized have had the vaccine, but they just got it. And a concern that has been raised throughout the world is that people who get vaccine, either the first or even the second dose, will not recognize their continued vulnerability until at least several weeks after the second dose, and even then can be sources of transmission. So I think continued reinforcement of these principles will be necessary, because people will begin to ask why we have a continued mask mandate, which is absolutely the right thing. Thank you.
Thank you, Stephanie. And our plan is to continue with that messaging, and you know, that is highly recommended, that even after the first dose, that people understand that we still will need to continue with the masking, social distancing, the washing of the hands. We'll still have to keep those measures up and continue with those activities. And then well after the second dose, making sure people understand that they still have that 2-week window. And as Dr. Granick talked about last night, the expectation is that the use of masks and social distancing will need to continue.
Thank you.
Did we lose Dr. Sturz again?
No, he was on mute again. Sorry. Any other questions of Bobby and Michael?
I have a question. This is
Please.
Alderwoman Lou.
Hi, Alderwoman.
Hi. I just wondered if there's any idea of how many vaccines are manufactured, how many coronavirus vaccines doses are manufactured a day or a week, or I know, you know, that's been the big concern with deciding whether to hold back vaccines so that the second dose will be available. Does anyone know that?
I'm afraid I don't know the answer to that as far as how much is manufactured a day.
Alderman Lou?
Okay.
Yep.
My understanding is that the impetus for the federal government to recommend that people proceed with vaccinating the next round of people is due to the fact that Pfizer and Moderna have announced that they will boost production by 50% over that expected, and therefore the stockpile that was intended for second dosing is being released, which will allow more extensive first dosing due to the fact that a higher volume is expected, although I cannot tell you the exact volume.
Thank you. I only asked because it seems like in all the discussion about that issue, that's never covered, and it seems like a piece of information that is most important. Thank you for your answer.
I just wanted to stick my hand up too.
Go ahead, Tom.
So I've heard this brought up about the numeric number of doses that are prepared or produced. We also have to keep in mind that there's a lot of other factors in place. For example, the military needs them as well. They have a bunch of sailors on an aircraft carrier, for example. They have an outbreak. That's not always something they can foresee or plan around. So they may be taking some for their needs that are unpredictable. Some states have much larger, denser populations. I know Los Angeles right now is going through a nightmare scenario. And Boston looks like they're doing a pretty good impression of one. So those are areas where snap decisions might need to be made, where you put more doses in a population dense area to preserve healthcare capacity, to preserve infrastructure, things like that. So we can't just look at this as a numeric, like, this is the number that's being produced, this is the number that's needed, because that number is fluctuating, and it's directly related to the decisions people are making over the holidays and even now in terms of not wearing masks or exposing other people, or proceeding as though there's a vaccine coming down the pipe, so we can drop our guard, and even policy level decisions like, will we return to school? Which districts will return to school? Will some of the districts that are adjacent to the districts sabotage the effort and decision of those districts? Will some of the private schools make decisions that contradict what's happening at the public school level? And then will those individual families commingle those? So there's a lot of factors that public health is generally trying to keep track of. That's also where contract tracing, I think Bobby mentioned in one of the committee meetings, basically has gotten overwhelming with the outbreak level. And that's data that would be better useful for communicating these different variables and giving people a better expectation. But I don't know that we are able to do that. It's a very complex problem with moving parts, leading right up to what is the federal level policy, and is that going to change with the new administration, and how's that going to be applied? So there's a lot of X factors that have to be accounted for too.
If I may add one other thing, which is hopeful, which is when we the United States and the state of New Hampshire began vaccinating in mid-December, there was one vaccine approved in the world, notwithstanding that Russia had the Sputnik. But now the UK, the AstraZeneca Oxford has been approved. And if you look at the New York Times vaccine tracker, you can see that there are 20 vaccines in large scale phase 3, meaning final testing. So I think that while all of your points are very well taken, and we're definitely in a holding pattern, it is expected that many more vaccines will come online and will also loosen up our ability to provide vaccines throughout the United States.
Any further discussions or questions? Looking good. Angela, are you out there?
Yes, hi, Angela Constantino, epidemiologist. Dr. Soros, I have a current COVID-19 situational update here on my report. Would you like me to go forward and provide that update? Okay.
Please do. Thank you.
So as of today, we have 91.8 million cases worldwide, and 22.8 million of those are in the United States, with 381,000 US deaths. In regards to community level transmission here in Nashua, we are currently exceeding 2 out of 3 indicators that push us into substantial transmission. Over the past 14 days, we've had 889.6 new cases per 100,000 people, which is down about 60 standardized cases compared to yesterday. We are also considered substantial in the percent positivity category. In the past week, there has been 510 tests conducted on average each day in Nashua, and 61 of those tests have been positive each day, which gives us a percent positivity rate of 12%. We're considered minimal in regards to new hospitalizations. In the past 2 weeks, we've had 2.2 new hospitalizations per 100,000 people, which is up about 1 standard hospitalization since last week. In regards to our case activity, there are currently 4,711 cumulative cases in Nashua. And of those cases, approximately 504 are currently active and infectious. And the City of Nashua Division of Public Health and Community Services is currently following 378 of those cases. We've had 1 additional death in Nashua since Monday for 61 total deaths and a case fatality rate of 1.3%. Our hospitalization rate in Nashua is at 2.4% compared to the state's rate of 1.8%. And then in regards to the state as a whole, there's been a total of 53,148 cumulative cases in New Hampshire, 6,239 of which are currently active. And then in regards to Massachusetts, their increased case activity continues. They currently have 90,975 active cases and are seeing about 5,000 new cases a day. As of today, 84.9% of their med-surg beds are occupied and 78% of their ICU beds are occupied. And there are currently 50 beds occupied through alternate medical sites. So that is the COVID-19 situational update. I provide this update at various meetings throughout the week, and continuously updating our numbers, updating our spreadsheets, keeping track of all of the data that comes in, and then compiling it and making graphs and charts when it's needed. We have tried to make our data more accessible to the public. Jane does Public Health Matters every Friday, and there's always a little bit of a data piece to Public Health Matters. And then we also, Jane and Nicole and myself, have worked on the COVID-19 data metric slide that you may have seen in the newsletter or on our Facebook, which really tries to boil down all the information, all the pertinent information, specifically the information about school opening and closing. So parents and community members can easily take a look at that short little infographic and see what's going on in the community, just for a little snapshot. And then we also update our data dashboard regularly, which has all of our information. Everything that the state has is also on our dashboard. So this is a good resource for people, especially because the state dashboard does take a bit of navigation. So if they just go to our dashboard, it's all laid out quite simply for folks. So we've attempted to make our data more accessible and more easy for the public to access and digest. And so then other COVID activities, I continue with disease investigation interviews, and then, continuing to work with the Board of Aldermen and Board of Ed to provide updates and guidance. And part of that is monitoring and compiling and analyzing our watch list outbreak and cluster data. And then, so non-COVID activities, we finalized our 2020 community health assessment. So we received lots of feedback from community partners, and it's sent to the division director for final review. So we're really excited about that. And then after we make all of the director edits, it'll go out for public comment, and then we'll be able to put out a press release that says that the CHA is open and ready to go. And part of that is we completed the community conversation and community portrait research projects. So you may remember the community conversation project was the substance use disorder in-person interviews, and it also had a survey attached to it. So we were able to wrap up that data collection and create a report on live stories. And we've gotten a lot of great feedback from our partners on that. So that's a piece of the CHA. It's one of our original research collection methods. And then the second research piece of the CHA is the community portrait page, which is our community facing survey, which asks community members about what they would prioritize in the city if they could, and what they consider to be priority health areas in the next year and the next 3 years. So we'll use that data when it comes to our community health improvement plan, which is coming up now. So now that we're closing out the community health assessment, we'll begin work on our community health improvement plan. And we have been meeting with the Greater Nashua Region Maternal and Child Health Work Group. We have access to insight formation software, which is like a strategic planning software. So that will be inputted into our live stories page, and we'll be able to build the chip out of that insight formation software. So we have a lot of strategic planning initiatives coming up that we're excited about and will be good to work on. Thank you.
Thank you, Angela. Any questions?
I had some or comments.
Go ahead, Tom.
So Angela, I collected some community feedback with regards to the live stories page and also the public health page. So on the city's general public health page, there isn't really a link or any kind of information about COVID-19. So when somebody Googles that, they don't get there. It's all over the city's front page and all that kind of stuff. But there is a couple of missed pages basically where people are Googling to public health. They're getting public health as a department, but they're not seeing a link or a way to get to that. So a little bit of feedback there. With the live stories, there's a lot of information on there. And the order of the page as you read it is basically, it starts with definitions and then it goes to school tracking and information, which is definitely important for the Board of Education and that kind of stuff, but might be helpful for one of the graphics that does a better job of just summarizing risk level in Nashua to start out, because people are sort of losing interest as they go. It's very helpful as a tool and I use it a lot, but people are kind of getting lost in it and I'm getting a lot of questions about like, what does any of this even mean? And I think it has more to do with just the order of presentation than any actual content. And then one thing I would like to ask and get a point of clarification on in terms of the Board of Aldermen is we have the recommendation still tabled at the Board of Aldermen. My impression is there's not the political will to implement it at this point. And my understanding from the previous meetings was that the urgency was related to Christmas and New Year's. So that's happened. And we're gonna have to deal with the after effects of how people treated those situations and what their activities were. The next major holiday benchmark that I see coming is St. Patrick's Day. So my question is there any value in still trying to push that forward, given the fact that it's a very uphill battle and restaurants particularly are 90% like reduced activity already because that's how it is in January and February?
Thank you, Alderman Lopez. I definitely took note of that, those live stories, that live stories feedback.
Yeah, and that was just intended as feedback. I mean, I figure you can do it with it what you want.
Yeah, no, that's great. That really helps because, we look at it every day, so it helps to have outside feedback. And then I'll turn your other question over to Bobby, if you want to respond to that, Bobby.
So Alderman Lopez, was the last set referencing the curfew?
Yeah, I mean, I realize that from a health perspective, obviously it would be better to do it than not to, but more in the context of community exhaustion and gaining that kind of engagement from the community in focusing on public health measures that they might be more receptive to. I don't know how much, I don't know if it does more harm than good to keep pushing that.
You know what, I think and I'm glad that you brought up St. Patrick's Day. I wasn't even thinking that far ahead.
Hopefully there'll be more inactivation, but it is something to be aware of.
But our environmental health department did something that was really strategic with regards to that last year. And so I'm sure that there are some other things that we could look at with regards to how we address some mitigative measures, you know, for St. Patrick's Day in, when is it, in February? See, I don't even know. I don't celebrate.
No, it's in March.
It's in March. Okay. So you know, and we could look at measures that that will work with you know, the restaurants, the bars, and it might even be, maybe it's a 1-day curfew, but that's something that we have to look more into. But I think some of the strategy that our environmental health department used last year, when March was when things were really ramping up, worked really well. And I know that Heidi and Ren are both on Dr. Sturz. If either one of them can add some comments in response to this, because they did some really good work when it came to
Please ask.
at that time.
Please ask them if they'd like to add anything.
Can I
Hi.
put an idea in just that I had suggested to Heidi a couple of weeks ago? In terms of when you, any of those efforts or recommendations should definitely be health-based and public health focused, but it would be probably helpful also to get a member of the community who represents the restaurant industry, if they're going to be impacted, to give feedback. I know Gia from Boston Billiards was particularly engaged. So one of the things I think I talked to Heidi about, which I don't know if she's moving on it or not, but looking at it from a public health education perspective, is coming up with general criteria to assign risk so that the public can be a little more educated in terms of, okay, well, I'm going to go to a place that everyone is going to be unmasked. So this is increasing my risk in this area. So then the following couple activities that I do need to be places where I'm masked and I'm not engaging in that kind of stuff. So I had pointed out there might be some value in having community engagement in scaling different activities for risk, specifically relative to Nashville.
Thank you, Tom.
I'm shutting up now.
That's okay. I did want to make one comment regarding Angela. She's quite impactful at the Board of Aldermen meeting last night. I got feedback on that with the statistics. Okay. Thank you, Angela.
Thank you.
Any other questions or comments? Anything like that? Thank you, Angela. I'll talk to you on Monday, I guess.
This is Stephanie. If Heidi and Ren have something, I certainly want to hear what they have to say. It looked like Heidi was about to speak. Yes, no?
Yes. Hi. Thank you.
Sorry, Heidi.
Yes, I was going to address St. Patrick's Day, and we are definitely going to be doing some outreach. Tom, thank you for your input and kind of methodology and how to do that. And we certainly do want some representation from the community members as input. But I think that probably environmental health's best skill is our feet to the ground and our direct interactions with restaurant owners and staff members. So that's how I had envisioned doing some outreach for St. Patrick's Day.
Stephanie, is that good?
Yes, but I do want to make a couple of quick comments. One is congratulations to everybody on the community health assessment. That I know that is a extraordinarily complicated and enormous undertaking, never mind at a time when you're also dealing with a pandemic. I was also not thinking about St. Patrick's Day, but to me, the bigger concern in my mind is the Easter holiday, because I don't think we're going to be a whole lot better position then than we are now, given how slow the vaccine is being rolled out. And also knowing that there are new variants. I mean, there are a lot of different, variables that might inform between now and then. So I think it's an ongoing assessment. I realize that the hour is late, and I know that several people, including myself, will need to sign off, earlier rather than later. But I think it would be helpful to have a running tally of the clusters and where they come from, because I think that will speak to not necessarily names, but institutions. You know, is it coming from restaurants? Is it coming from bars? And I would rather see us, both for short-term and long-term gains on behalf of the community, develop a regular roundtable, if you will, with restaurant and business owners, so that they have a better understanding than can be gotten by them listening to a Board of Health meeting, or even an individual visit from public health.
Or certainly from the Board of Aldermen meeting.
I'm sorry?
I said, or certainly that they can get from the Board of Aldermen meeting.
Right, because, you know, I mean, I was just so overwhelmed by the interest in our last Board of Health meeting, and, you know, how there were so many questions and so much misunderstanding that I don't think were resolved by that meeting. But given that there was no political will to do anything for Thanksgiving or Christmas, which are not one-off days where, you know, people get together for a celebration, but rather, you know, people cohort with big meals and all kinds of things, that I would rather see on us focus on individual responsibility and you know, I think the education about and promotion of the risk categories is critical. They're already, in essence, outlined on the CDC website, so it's not like we'd have to recreate something. But that would just be my impression about what will be most protective to the community.
Mhm.
Any further comments?
I appreciate those comments.
Okay, going once, going twice. Thank you, Stephanie. We'll make sure that we get those addressed. I'm now looking at, I believe, Nicole. Yeah. Nicole, you're up.
You're on mute, Nicole. I think that's kind of be a phrase in 2021 as well, huh? We thought it was just 2020. You're on mute.
Can you hear me now? I had to call in. I was having audio problems.
You're good.
Okay, awesome. I'm actually on mute, which is kind of funny. So mute is on mute. I don't, it's confusing. I'm Nicole Shute, the Health Promotion and Communication Specialist. So related to COVID activities, in December, I continue to participate in the various COVID response meetings, as well as continue to lead our city's Joint Information Center. And we still meet every other week to provide updates and just work together on any communication issues. All of our social media pages and website were updated with the latest information, and we do continue to distribute our weekly updates to regional partners. In December, we worked to push messaging to provide education to reduce the spread during the holiday season. As Stephanie had just mentioned, we will continue that as holidays come up this spring as well. In regards to vaccine messaging, our vaccine page on the city website is published, and it is continuously being updated as new information is available from the state. The page does include direct links to the state and the CDC vaccine websites, and we'll just continue to push out any vaccine information as soon as it is available to us. Recently, our staff has been receiving vaccinations, so we've been promoting that on our social media pages and as well as in our newsletter. And Tony will most likely be featured in this Friday's newsletter. And we also printed some stickers that say, "I got vaccinated against COVID-19" that we're hoping to distribute at vaccine sites. And we should be able to get them into the National Guard fixed site in Nashua. They're just working out some logistics. And as Bobby had mentioned, we did hire the new community health workers who we just started meeting with on a weekly basis. So I'll be able to provide a further update on our work with them at the next meeting. And then our communications team internally met this week or last week, I can't remember, but we are working on some new educational marketing materials, so stay tuned. We will have some new materials and a small toolkit to provide at the next meeting. Other than COVID, some of December's messaging priorities included World AIDS Day, Hand Washing Week, gifting safe toys during the holiday, We did a lot around food safety, immunizations, STD, HIV, and hepatitis C testing, winter preparedness and safety, and around mental health. And for World AIDS Day, we did complete a Facebook advertisement to promote HIV testing in Nashua. And as Angela mentioned, we did, our community health assessment is in the final review process. So while we wait to send it out to public comment, I'm just currently working on the press release that will go out, some website updates, and additional promotion. Some other activities. So I can't believe that it is that time of year again, but we're in the early stages of planning for Public Health Week, which is April 5th to 11th this year. It will be a virtual celebration, and we're just currently waiting on some more information and daily themes from the American Public Health Association. And I did schedule a planning meeting for our team to meet at the end of the month to start planning some local celebrations and events online. And then in March, we will also have a billboard for World TB Day, and that will be on the Nashua Hudson line. We'll also be running 2 social media educational campaigns for child lead poisoning in the spring. One of these campaigns will target new home buyers, and one will target landlords and contractors for renovations. And that social media campaign, we're actually working with the Community Health Institute in Bow to develop. Other than that, we are working on preparing for the Mayor's Opioid Task Force Legislative Breakfast that will be on the 29th. And we're hoping to send out the invitation today or later on this week. And I guess last but not least, we're still planning to run the mental health campaign that I had talked about at the last meeting or one of the previous meetings. We will be pushing the Change Direction 5 Signs of Emotional Well-Being campaign. We're just working out some logistics and a contract with that. So we're hoping that will be able to be pushed out in the spring. And that is my update.
Thank you, Nicole. Thank you for getting my good side yesterday.
And the dog.
which is no good side at all. Here's the thing that Nicole was talking about, the sticker for vaccinations. And I've got mine. I'm going to frame this and covet it forever. Does anybody have any questions on Nicole, please?
Yes. Oh, Nicole.
Go ahead, Chuck.
Thank you so much for all your efforts. And when you get the 8x10 of Tony, can you give us all a copy? I'd love to have it in my office. That would be great.
I'll make sure we frame it.
Yeah, he doesn't want glass on it. So that way he can throw darts.
But also the January messaging about the STI clinics was phenomenal. Maybe a shout out for, I liked how you had the calendar and of the actual days and where everything was being offered and the times. Is that something that would be too much effort to get out to PCPs and primary care practices? Because I printed them out and put them all in our 20+ exam rooms this week, just so all the providers would have them, and just a wonderful resource.
Yeah, not at all. It's actually easy for us to get them printed and made. It's harder for us to get them out in that sense. We do have these mobile van outreach postcards that we print every month, and we actually put that schedule as a sticker on the back so they don't go outdated. So if you ever want hard copies, just reach out to me. I'd be glad to provide them to you to give to providers.
Yeah, but just even the format of the newsletter, I'm happy to at my end just to take them out and print them in my end and put them in my exam rooms. But I think if from family practice too, I sent it around to the family practice people too. I think it's a great resource because it's so unused, and you guys do a phenomenal job as always. Thank you.
Thank you.
Any other questions for Nicole? Seeing none, and I can say I can't see anything but Nicole. So if you do have a question, go ahead and chirp right in. Going once, going twice. Bob, are you cleanup batter today?
Good afternoon. Thank you for your time here. I'm Bob Mack, the welfare officer for the city of Nashua. Just to report out quickly on the welfare department for the month of December. You can see in the report, our expenditures were fairly level as compared to this time last year. When I sent this report out, I did have one inquiry from the Board of Aldermen as far as why our expenditures were remaining low in this time of need for a lot of folks. And that is primarily because of the fact that there was a significant amount of emergency rental assistance funds that was injected into the community through Southern New Hampshire Services, the CAP agencies. And we work very closely and continue to work closely with our community partners that also do prevention assistance around evictions. So that was able to keep our expenditures fairly level. There is some word that there may be some additional funds coming into the state, but that hasn't been verified. A webinar I participated in last week indicated some significant funds may be coming to the state of New Hampshire. And I had reached out to Melissa Hatfield, who is the director of the Bureau of Housing Services at the state, and they're kind of waiting to see how that money is going to come into the state and how that may be dispersed. If I had to guess, I would say it may be similar to previous emergency rental assistance funds. As Director Bagley, I believe, noted in her report, we were able to update our financial standards in the welfare department. We take a look at these pretty much every year, or as there may be some significant changes in rental costs and costs of living. And that legislation went through the Board of Aldermen and was approved in December. And that really just helps us to make sure that we are assisting people and using accurate and current calculations for rental costs, food costs, things like that when determining eligibility for assistance. We are also working with our community outreach teams and our community partners to complete the annual point in time count, which is coming up at the end of this month in January. I believe the date is the 27th. So we will work closely with them. And oftentimes our own Division of Public Health and Community Services outreach workers help with that count as well. And let's see, the last thing I'll mention is the welfare staff continue to support the division in COVID responses, whether it's covering the hotline or doing whatever assignments are given to them to support the division in response to COVID. And that's in addition to their other day-to-day duties within the department. That has been something that's really been across the division. So it's been a great team effort, and we'll continue to do what we can do to support that effort. With that, I don't know if there are any questions.
Thanks, Bob. Any questions? Comments? Predictions? Anything? Going once? Going twice? Thank you very much. I'd like now, is there any other issues, old business or anything? Bobby? Go
I
ahead.
just wanted to, as we've been moving forth in its effort, and we've pushed out all the information about, things that we're doing to stop the spread of this virus and, infection and death and disease. Our next phase that we're moving into, and I'm sorry I neglected to put this in here, is the vaccine phase. So you guys have already known, and Stephanie mentioned it early on in the meeting about the vaccine. So we are in a position as the public health regional lead to get prepared to schedule some clinics and some pods in our community. One of the things that our state is looking at is making sure that there's at least 10% of allocation made for the vaccine to be available for those who are underserved in our community that meet our criteria for a social vulnerability index. So it might have to do with their economic level, housing insecurity, race and ethnicity. And so we have it as a part of our function in the region to make sure that we can assure that these clinics take place and that individuals that don't have primary care providers who are expected to register through their primary care providers or through some other means to make sure that we can get that population group vaccinated. And so we have our internal team, core team that's going to be working on those efforts, which includes our chief public health nurse, our immunization nurse coordinator, Trisha Glassstetter, and Jen Swabowitz and Kim Bernard, as well as our emergency preparedness coordinator and our public health network services regional coordinator. So those things will be ramping up. It will involve our communication specialists, our public health strategist, Jane Goodman, and the community health workers, as we look into how we reach into and make sure that these population groups are vaccinated. And as Bob mentioned, it really does, also involve the whole division. So even though we may have that core team that's going to be working on this, our Board of Health, we're going to need your support, because we are going to get, as you guys know, probably slammed on a lot of things as we roll this out, because we need to maintain a fidelity of what the state has put out in their vaccine allocation plan. And we're going to try and do that as best as we can. We do know that we have to be creative as we reach out to these populations. Environmental health makes contacts with all kinds of individuals that fit into that social vulnerability index. And so they're going to be helpful with us making those connections along with our community health workers. And so it's still going to be a big team effort. Our welfare department is going to have folks that are coming in that fit into that category. So we'll be able to identify individuals in a lot of different ways. And our team is going to work together to make sure that we can get vaccine into those arms, as well as those that fit into the other categories that our other partnering agencies will be able to accommodate. So, I just mentioned earlier on, we're doing more with less. Well, there's another thing that's just added on to that there's an expectation for us, again, as the public health lead, to work with that. We have some phenomenal partners. Our schools have reached out already. Our nursing schools, Riviera, NCC, have reached out. St. Anselm's have reached out to provide staff to help with the vaccine clinics. We've had churches already invite us to use their space, their parking lots and all. And so we're positioned well, and our planning team will be working so that we're prepared in that last week in January to at least begin rolling out a pod or a clinic to vaccinate the 1B category, as well as assist continual vaccination in the 1A category. I don't know if Alderman Lopez is still on, but he did ask, because the point of time is an opportunity for us to have a day where we can focus on one particular population that fits into that social vulnerability index, and the state has actually approved us being able to do that. So we will be working on trying to coordinate an effort of vaccinating homeless folks on the 27th, which means, again, there's lots of planning, lots of ramping up. Our staff has been phenomenal in the responses thus far, and I believe that we'll be successful in these endeavors around vaccination as well.
Thank you, Bobby. Any questions for Bobby? Yes, Chuck?
Oh, hi, Bobby. Well, thank you. I had a question. We all get multiple emails from multiple sources. I'm on 5 different hospital emails every day and updates. So one of which I was struck by yesterday, that one of the local hospitals sent an email that said they had 6 extra vaccines. Come, first serve, come down and get yours, because we have to use it. I guess my question to you, especially as you talk about social vulnerability index, I'd hate to have this become political, but I know it is what plans do we have as a public health department that it isn't just the rich and famous get the vaccines? And I think that email came across, and it struck me like a lead balloon, that we're just kind of offering it to the highest bidder. And it was really kind of unfortunate the way it was presented. And all I could see was a rush to the cafeteria, to beat someone to the line in the front of the queue. So I just think we need to be aware of that vulnerable population, as you do better than all of us, but just to make sure we're, that it's out there, that we have to have a strategy here. So,
right.
And you have your daily phone call. So I just, feedback to that phone call meeting would be, I think for those of us who aren't on the front lines, that was a general widespread hospital sent message, that it came across as very unfortunate that it seems like anyone who could make it to the cafeteria in the next 10 minutes will get their vaccine, regardless of risk factors, regardless of whatever. And I just think that's the wrong message.
Yeah.
So, so my point being, could we bring up that if there are situations like that they had extra, that the first line of defense would be a phone call to you and say, hey guys, we got 6, in this case, vaccines. Could we, can you use them? Because we have to use them by the end of the day or something.
So, Dr. Sturz, is it okay if I respond to that? So with the way that the vaccine allocation is distributed, the hospitals and the long-term care facilities, we're getting different vaccines. So some have gotten Pfizer, and then Others are getting the Moderna. So what we have in place right now, Dr. Capetta, is that at the fixed site that we have at National High South, if they have vaccine left over, they do call us. And so Patty Kirker, who is our Public Health Network Services Coordinator, is the point person. So they will give her a call. And she's already started, a list of, keeping a list of folks that are in the categories, the phases that the state has identified, so that those folks can be called to go and take advantage of getting those vaccinations. And so for instance, on the list, we had some of our public health staff. So when they had extra vaccine, she was able to get that staff over to get vaccinated because their vaccine date hadn't, come up yet. Part of the criteria with that, they talked about the vaccine waste that could be an issue. And so the hospitals, they get a certain amount of allotment, and in order for them not to waste that, I think that's probably why they did what they did, because they didn't want to just waste the doses. So they just wanted to get it into the arms. And that's the instructions that the state has put out. They could do that more judiciously, because I'm sure there's other people that were probably at the hospital that were high-risk folks that probably could have gotten that. So each entity, organization, they're leaving that up to them. We have something arranged with the fixed site that they call us and let us know. And so we're keeping a list. Folks do have to be signed up or registered. And so there's a way that Patty can make sure that happens, so that again, the vaccine can get in arms and it can be tracked, because they really want to track every single dose that's either wasted or that's given to an individual. They want to make sure. They also have a little questionnaire that says, was this vaccine administered to someone that was in the categories or not? And then if not, who was that person that you gave the vaccine to? So everybody's been held accountable for what they're doing with the vaccines as they've been administered. So we're going to do our best, to make sure that we do not do that. I heard on NPR this morning, they were talking about how the vaccine trials were done in some African countries, which made them, again, have a pool of people so that they can evaluate how the vaccines work in different population groups. And they have not received any vaccine in those countries to be administered. So no, we do not want to be like that. We're going to make sure that we do our due diligence to reach out to the populations. And as I said, the state has a specific allocation to make sure that we reach those population groups that may not normally be in those settings, right? Make sure that we get to those populations. So that's what we're going to work hard to do, Dr. Capetta.
Thank you. Thank you very much. Makes sense.
Thank you, Bobby. Any other old business? Seeing none, I'd like now to open it up to public comments. Anyone have any questions, comments, concerns? Seeing none, I am looking for a motion to adjourn.
Yes.
One. Moved by Chuck, second by Stephanie. Those in favor?
Yes.
We are adjourned. Thank you, everybody.